On March 5, 2020, the Faculty of Medical Sciences Teaching and Research Complex, the UWI Mona campus, held a conference entitled COVID-19 Pandemic Preparedness. Speaking on community preparedness is Dr. Webster Kerr.
With respect to COVID-19 globally, this is of yesterday, this is WHO report. We had over 93,000, most of which we know is in China. Outside of China, there are over 12,000 cases in 76 countries. And we see the deaths there. With respect to the region of the Americas, this is a little dated, 1 day old, and there are a number of countries in our region that is affected with local transmission in the US and Canada. So I'm going to, because the community response is really Jamaica's response, right? And we know that following the declaration by the International Health Regulation Committee, the World Health Organization declared COVID-19 outbreak in China a public health emergency of international concern. On the 30th of January, this was on the 30th of January. On the 31st, the next day, Jamaica put in a travel restriction for persons coming from China. This was taken at the level of the cabinet. On February 27th, we added 4 more countries: Italy, Korea, Iran, and Singapore. And we are operating our National Emergency Operations Center. So what are we planning for? So we looked how many persons, etc. So we looked at some projections. We used the data we had, the changes that we saw 2008, 2009. We looked at the reproductive rate for influenza and the reproductive rate for SARS-CoV. We looked at also the surveillance data and a burden of disease study of 2009 and some other health data that we have. We looked at the critical care. We used the SARS value, which may be an overestimation, and based on Dr. Jackson's presentation, we're looking at around about 10% for critical care. So what are the projections? So over a year, we are looking at 2.6 million cases of acute respiratory infections. That is, we usually have about 1 million. So this is additional, right? And of that, about 1/3 will seek medical care. And this we know will be public and private. Within the public health system, we estimate that we have over 400,000 and SARI admissions of about 1,800 to 2,000, with 360 requiring critical care. We looked at what could be the peak week, and for that week, we estimate that we could see about 16,000 persons in the peak week in our public health facilities, of which 55 will be admitted and about 11 will need critical care. We estimate that the peak would occur about 8 weeks after the inflection point on the epi curve. So I just put this up to show you a little bit more. So our cases will be about 1 million, 1.1, 1.2 to 1.7, and those who seek care may be up to 900,000. And within the public health system, up to about 411,000. Some will seek care at our health centers, and some will seek care in accident and emergency. We looked at it, see how that compared to what we normally see, and that's about 3 times what we normally see. Just to say that we have done projections for visits to our different facilities to give us some sort of something to work with. We also did it for all the disposables as well by health facility. So our plan, we use the pandemic influenza plan to do the COVID-19 plan, and we looked at 3 phases: the interpandemic, alert, pandemic, and recovery phase. We are now in alert because the WHO has not put us in a pandemic phase, so we are alert phase. The objectives of the plan is to guide and coordinate the management of the response and the implementation of this action plan. We will monitor and evaluate key actions in public health to ensure their effectiveness. Really, we want to delay as much as possible. Then we need to detect, contain, manage, and we need to communicate what is happening and to mobilize resources to ensure the implementation. So our strategic areas are planning and coordination, situation monitoring and assessment, prevention and containment, health system response, and communication. These are our main activities or the main actions that would occur. Just to say, there's a very detailed plan. I'm not going to go through that. But where we are is alert phase, and in Jamaica we have no cases. So for example, right now quarantine procedures is what we hear about, although the effectiveness of it is decreasing as we speak, as the virus spread throughout the world. So these are the details which will become available within the next week for the general public to see. Our care infrastructure, the projections that I shared with you earlier, had the number of visits, hospitalization that we have predicted. So what we have presently, our present isolation capacity, most hospitals can hold a patient. Hold, did I say isolate? Can hold a patient, or patients will hold patients. There are nationally contact and droplet precaution 15 beds, and airborne precaution 4. And Dr. Bruce spoke about some of these. Our surge capacity, we have to look at that, really needs 380 hospital beds, which we would do, remove probably elective patients. So let us look at the context. We see up to like 3% of our hospital admissions as SARI cases. If we have 3 times as many, that means 9%. So that's the context we are speaking within. We currently don't have enough ICU, HDU beds, as we all know. So the plan is to outfit the PROMAP beds, which will not be used until July, or scheduled to be commissioned until July. So we are planning to outfit that, and that will give us 38 more beds, 9 of which are truly isolation beds. So at this time we don't have any cases, and it's likely that our first case, not absolute, will be somebody with a travel history. And what we will pay attention to is that travel history. But we have this definition of person under investigation, which may not have that travel history. And we will test those. All these persons who are persons under investigation or person of interest will be tested in the first instance. If there's an outbreak, only SARI cases will be tested, and then we do public health sampling after that. Quarantine, we quarantine well persons who may have been exposed, right? So quarantine may change over time, and we will do mostly home quarantine if possible. So this is our budget. It's about $1.9 billion, and most of it is for the operations. That's billion. So 1.9 billion is 1.1. The million is at the end, so you multiply by yes. So the PS, I was supposed to have followed him to Ministry of Finance, so he's defending this budget right now. Hopefully he defended it well, and we will get it. But there are many risks that we have identified. Just our first case, the possibility of panic. And so we are systematically going through the risks that are likely, and seeing how we can put in plans for the mitigation of these risks. We spoke about water and sanitation. We have some issues with water, so that was a discussion in the National Disaster Risk Council meeting today, and the ensuring that these persons have water, because hand washing is critical. And the access to critical supplies, everybody is buying up the supplies. So we work with our partners to see if we can get more. So just to end with some of the messages and some of the information material that has been developed so far. So there's one for traveling, general information on the coronavirus. This one is specifically for persons in quarantine. So there's a brochure which is explained to persons on entering quarantine. There's also taking care of your emotional health. And this is looking at persons who may be restricted, their movements may be restricted. This is just one half of the brochure. And then there are some other general information. So that, in a nutshell, is what I have to present today.